Hey, welcome back. If you're new here, this channel is all about helping healthcare operations professionals actually apply Lean Six Sigma, not just study for a certification and forget it. Before we dive in, I want to let you know that this video is part of the free training available inside the Lean Six Sigma Accelerator community on Skool. If you're not already a member, the link is in the description. It's completely free to join, and inside you'll find templates, tools, live sessions, and a community of healthcare operations professionals who are doing exactly what you're doing, building their improvement skills on the job. The link is right below this video. Go grab it after you watch. Now, today we're talking about quick wins. And I want to start by saying this. If you work in healthcare operations, you are probably already doing quick wins every single week. You just might not be calling them that. You might not be documenting them. And you are absolutely leaving career capital on the table if you're not tracking them. By the end of this video, you're going to know exactly what a quick win is, how to spot one using a 5-criteria framework, and how to use this checklist template to start building your continuous improvement portfolio. Today, let's get into it. So let's start with the definition. A quick win in the context of Lean Six Sigma is a low-effort, high-visibility improvement that can be implemented rapidly and at no cost to your team. Now, I want to unpack each piece of that because every word matters. Low effort means it doesn't require a project team, a steering committee, months of analysis, or an IT ticket that sits in a queue for 6 weeks. A quick win is something you or your team can act on. High visibility means people notice it. Leadership notices it. Your team feels it. Even a small change that makes someone's shift 10 minutes smoother is visible, and that visibility matters. Implemented rapidly. We're talking days to 2 weeks, not a quarter, not a cycle. Fast. At no cost, no budget required, no capital expenditure, no new headcount. It uses what you already have, your team's time, tools already available, and processes already in place. Now here's the part people miss. Quick wins are not root cause solutions. They're not the full fix. They address a symptom, they reduce friction, they build momentum, but they don't replace the deeper diagnostic work of a full DMAIC project. That's actually an important distinction, and we'll come back to it. What quick wins do accomplish is this. They demonstrate early ROI to leadership, they build team buy-in for larger changes, and they prove that your improvement work is already delivering results, even while the bigger project is still underway. In Lean Six Sigma terms, quick wins live at the white belt and early green belt level, which makes them perfect for professionals who are just starting their improvement journey. You don't need to be certified to spot a quick win. You just need a framework to evaluate one. That's exactly what this checklist gives you. The quick win identification checklist is built around 5 criteria. An ideal quick win meets all 5, but even 3 or 4 strong checks can make an opportunity worth acting on. Let me walk you through each one. Criterion 1. Easy to implement. This means the change can be done with minimal training, minimal coordination, and no complex systems change required. Think, no IT, no policy revision, no vendor involved. Example from the checklist. Printing and laminating updated triage scripts. No IT ticket, no policy approval needed. A team lead can make that call. Criterion 2. Reversible. This is huge, and it's the one people forget. If the change creates an unintended problem, can you undo it quickly without risk or disruption? This is especially important in healthcare, where patient safety is always on the table. Example, rearranging a supply cart layout. If it turns out the new layout is more confusing for night shift staff, you move it back. No harm done. Criterion 3. Fast to implement. Can it be fully in place within 1 to 2 weeks? No multi-phase rollout, no pilot period that drags on for months. Example, adding a daily 10-minute huddle to shift change. You can start that this week, same week. Criterion 4. Within the team's control. Your team has the authority and resources to execute this without needing external sign-off. You're not waiting on the CFO, the CMO, or a committee meeting that's 3 weeks away. Example, creating a shared folder for patient education, DEP, PDFs. Your team can do that right now, independently. Criterion 5. Free to implement. No budget required. Uses existing staff time, materials already on hand, or tools already available. Example, updating a discharge checklist in Word and reprinting it. 0 cost. Now here's how you use these criteria. For For each opportunity your team identifies, you check it against all 5. Use the checklist to rate it. 5 checks is an ideal quick win, act on it now. 4 checks is a strong candidate. 3 checks, consider it with caution. 1 to 2 checks, defer it or take it off the list. The scoring guide is right in the template, so you don't have to remember any of that. It's built in. Now let's look at how the template is actually structured. The top of the document has a header where you fill in your project name, team lead, and date. Simple, but important. This becomes part of your documentation trail. If you're building a continuous improvement portfolio, having your name on dated deliverables matters. Then there are 4 numbered sections. Section 1 is the definition we just covered. It's a quick reference so anyone picking up the checklist understands what they're evaluating. Section 2 is the 5 criteria table. It gives you the criterion name, what it means, and a healthcare operations example for each one. Really helpful if you're introducing this to a team for the first time. Section 3 is best practices, a short do/don't list. I especially want to highlight 2 of these. Do. Brainstorm with your full team. Frontline staff see things that managers never see. Always involve them. Don't. Confuse quick wins with root cause solutions. A quick win reduces friction. It doesn't fix the system. Section 4 is the actual checklist. It has 10 rows, 8 pre-populated with realistic healthcare examples, and rows 9 and 10 are blank for you to add your own. For each row, you check whether it meets each of the 5 criteria, and there's a notes column for anything you want to capture. And here's what I want to emphasize. This is a template. Please customize it. If your improvement area is in a specialty clinic versus an inpatient unit versus a managed care environment, the examples should reflect your context. Add rows, remove rows, rename the header with your department name. Make it yours. Let me walk you through 3 different roles and what quick win identification might actually look like for each one. Example 1, Operations Manager. Inpatient unit. Say you're an operations manager overseeing a med-surg unit. You've been hearing from charge nurses that shift handoffs are taking longer than they should, sometimes 20-25 minutes, and information is getting lost between shifts. You open the checklist. You write standardized nurse shift handoff communication using SBAR template. Now you score it. Easy to implement? Yes. SBAR templates already exist and are widely recognized. No training program required. Reversible? Yes. If staff find it doesn't work, you go back to the current process. Fast to implement? Yes. You can introduce this at the next staff meeting and have it in place this week, within your team's control. Yes. This is a unit-level practice change, not a policy revision. Free? Yes. Print it, laminate it, done. That's 5 checks. Ideal quick win. Act on it now. And notice, you're not solving the root cause of why handoffs are slow. There may be staffing ratios, documentation system issues, or patient load patterns driving that. But this quick win reduces friction immediately while you continue the deeper investigation. Example 2. Enhanced Care Manager, ECM. Specialist. Now let's say you're an ECM specialist working with high utilizer patients in a managed care setting. Your team is responsible for coordinating care across providers, and you've noticed that patient education materials keep getting resent, either because they weren't documented or because different team members were using different versions. You write, create a shared digital folder for frequently requested patient education materials, standardized and version controlled. Score it. Easy to implement? Yes. It's a folder. No IT department needed for a shared drive in most organizations. Reversible? Completely. You're not deleting anything from the old system. Fast? Yes. You could build it this afternoon. Within your team's control? Yes. Free? Yes. 5 checks. And the downstream impact? Less duplicated effort, consistent patient messaging, and documentation you can point to when the care team gets audited. And here's the portfolio angle. If you're building toward a Green Belt certification, this is an example of a process standardization quick win in the improve phase of a DMAIC project. Document it. Write a 1 paragraph before /after note. That's a portfolio artifact. Example 3. Claims Analyst. Let's shift to the revenue cycle side. You're a claims analyst and you've noticed that a specific denial reason, let's say incomplete clinical documentation on auth requests, keeps coming up. Your team is spending time on rework that feels avoidable. You write, create a laminated quick reference card for the top 5 required documentation fields for prior auth submissions, posted at each workstation. Score it. Easy? Yes. You make the card in Word or Excel, print it, laminate it. Reversible? Yes. Remove the card if it causes confusion. Fast? Same week. Within your team's control? Yes. You don't need authorization from the payer, you're just improving internal prep. Free? Yes. 5 checks. And what you're doing here is error proofing. That's a lean concept called poke-a-yoke. You're building a visual cue into the work environment that prevents a common mistake. That's white belt thinking in action. Here's the bigger picture I want you to see. Healthcare operations professionals implement quick wins constantly. You do it without even thinking about it. You fix a broken workflow, you create a shortcut, you standardize a communication process, and then you move on to the next thing and never document it. What the Lean Six Sigma Accelerator is teaching you to do is to see those moments for what they are, deliberate process improvements, and track them as part of your continuous improvement portfolio. Every quick win you document with this checklist becomes evidence. Evidence of your problem-solving mindset, evidence of your Lean Six Sigma knowledge, evidence for your next performance review, your next job application, your certification portfolio. You don't need a formal project to start building that record. You need this checklist and a habit of looking for opportunities, and the more you use it, the better you get at spotting them. It starts to change how you see your work, not as a series of tasks to get through, but as a set of processes to continually improve. That's what Lean Six Sigma is really about. All right, let's recap. A quick win is a low-effort, high-visibility improvement that is fast, free, reversible, easy to implement, and within your team's control. You score each opportunity against those 5 criteria, and you focus on the ones with 4 or 5 checks. The template is already built for you, with healthcare examples, a scoring guide, and space for your own opportunities. Customize it for your specific role and improvement area. It's yours to use, and most importantly, you are already doing this work. You just haven't been naming it, scoring it, or documenting it as Lean Six Sigma. Now you can. This template is part of the free training inside the Lean Six Sigma Accelerator community on Skool. If you haven't joined yet, the link is in the description. It's completely free, and it's where all of this content lives, along with a community of healthcare ops professionals learning and growing alongside you. If this was helpful, give it a like. Leave a comment with the quick win you're going to tackle first, and subscribe so you don't miss the next one. I drop new content regularly, and every video is practical, built for people doing real improvement work in real healthcare settings. I'll see you in the next one.